Thank you very much for all my professors who gave me this chance to stand here today. Now I'm going to talk about refractive meridional corneal collagen cross-linking, a new defined technique for treatment of astigmatism. I have no financial interest or relationships to disclose. I acknowledge the utmost help, support, and work of the Future Center team in Suhail. The astigmatic challenge in keratoconus management, the remaining postoperative astigmatism following cross-linking, intracorneal rings, or combined procedures is the most challenging obstacle to be corrected surgically. So what's on my mind? What if we treated the steep meridians with cross-linking to flatten them? The idea. The post-operative flattening of the steep meridians with cross-linking is the idea of this research. Hence the name, refractive meridional cross-linking, Rmcxl, or simply I call it Rmcxl. Rmcxl can be achieved best by using the area of cross-linking as a refractive procedure, ensuring that the steep meridians are the only meridians to be cross-linked. Imagine this is the chart of corneal meridians, and the steepest meridians is 120 degrees in axis. So in Rmcxl, I will cross-link the steep meridians in a fan-shaped pattern. Actually, I take a bunch of steep meridians. Okay, let's can say simply that it starts from 115 degrees to 125 degrees. And if we have clearer rings or shorter rings, it doesn't matter because we are centered on the steep meridians. We can still cross them. The purpose was to evaluate the efficacy and safety of using corneal collagen cross-linking as a refractive procedure to correct corneal astigmatism. It was a prospective, non-randomized clinical trial study. 15 eyes of 11 patients complaining of astigmatism were treated with Rmcxl. Group A, the keratoconic group, included 8 eyes which had previous cross-linking and corneal rings that failed to correct astigmatic component of keratoconus, while Group B, on the other hand, the non-ectatic group, included 7 eyes with astigmatism without corneal ectasia. All eyes were subjected to preoperative and postoperative uncorrected and best corrected visual acuity, refraction, slit-lamp examination, and pentagrams. The protocol for Rmcxl. When you have keratoconic eyes, postoperatively, if we implanted previously my ring, actually I don't do Rmcxl for them. But if you implant Kira or Ferrara, yes, you can do any of Rmcxl for them. By removal of the epithelium in a fan-shaped pattern with exposure of the steep meridians away from the rings. Then dropping off the riboflavin on the fan-shaped depithelialized zone. 10 minutes riboflavin Vivix rabbit every 2 minutes, with 8 minutes cross-linking using a dehydrogenation 1 with pulsed mode and 30 milliwatt power. On the non-keratoconic eyes, we use actually the area of Rmcxl in the same technique. This simple movie will show us how we can do such technique. At first, I must mark the axis at hertz 120. And after I put the marking of the axis, I start removing the epithelium in a fan-shaped pattern that it takes about 5 degrees on both sides of the steep meridians. So that I use a blunted spatula which allows me to gently and simply remove the epithelium from these selected meridians. The actual results that what will show, this is previously cross-linked eye with remaining astigmatism, and I choose not to use the hard contact lens. I choose to do Rmcxl. What we had in the results, and I start showing a fried hidden Vivix rabbit on the meridian, And the Rmcxl, as we know, will penetrate only the epithelialized zone and leave the epithelialized zone without penetration. So I'm not afraid of cross-linking the epithelialized zone. I'm not. This is the pulsed mode, and we can see that the stream of, you can see that the center green line is the stream of the fan-shaped cross-linking of Rmcxl. This, after finishing, simply we can use spot contact lens, and we take the sample, the usual treatment. Then wash it right again and put in the contact lens, and we can see that we have only small area of the epithelialized zone, and that will be healed within 24 hours with our regular treatment. Where is this? In group A, the keratoconus group. The most important result in this group is the lowest. The mean postoperative astigmatic reduction in spectacle correction, wow, look, it takes up to 2 diopters reduction in the steep radius, and that's good, that's really good. While in the non-ectatic group, nearly the reduction is not quite as in the keratoconus group, that up to 1 diopter, so that in keratoconus group, we gained much reduction of astigmatism that is double of that of the non-ectatic group. We can see here these examples. The first example of the keratoconus group, the pre and post-operative data of right eye of one patient with keratoconus. This patient, as you can see, pre-operatively had radius, cross-linking, and rings implantation, and we can see that we have 5 diopters astigmatism. Over 6 months post-operative, there was a reduction in the steep meridians to be 3 diopters astigmatism, and that we made a reduction of 2 diopters, and this is really good. Example of group B, the non-ectatic group. This patient had 3 diopters astigmatism, however, pseudophakic and not ectatic. Okay. 6 months later, it became nearly 2 diopters astigmatism with a reduction up to 1 diopter. So what? My first impression, Rmcxl is a good refractive procedure for correction of astigmatism in both ectatic and non-ectatic corneas. Rmcxl is a promising, tube simple, cheap, effective and safe procedure to treat corneal astigmatism with reasonable patient satisfaction. Thank you.